For Shauna Burke, Ozempic has been worth every penny, but it's come with a big price tag.
I still, like, I've been doing this for 2 years now to try and get it covered. And I'm on AISH, and they keep denying me. This is the only thing that keeps my sugar down. Everything else, like, tears my stomach apart.
For many Albertans, Ozempic has helped manage diabetes, improve heart health, and support weight loss, but the cost has been a big barrier until now.
And plus, I'm hypoglycemic. And sure, I'd like to lose some weight. That'd be lovely. That affects my heart problem, my kidneys. Um, Ozempic helps all that. You know, maybe I'm not losing it. That's okay, but I know that it's helping my heart and my kidneys and everything else, right? The first line here, and then press the button. It's not covered for me. So if I'm paying 260 for one, now I can get two, move up to the next one. You know what I mean? So that way maybe it'll help me a bit more. Yeah, the benefits outweigh the price, unfortunately. Some people have to, pay out of pocket, and I do.
Unison TV went to find out what older adults need to know about taking the new lower-cost generic versions of Ozempic.
It helps with the mobility and making the patient independent, especially for seniors, because basically when the person loses weight, the burden on the joints would be less, so their mobility would be better. This is one point. Another point, it reduces the bad effect of diabetes on the eyes, on the vision, on the kidneys. So this improves the quality of life for these people, and also makes them independent and like mobile, which is very important.
But regardless of the deal, especially for seniors, you don't want to be taking it without all the facts.
It's a very significant tool. It's a very useful tool, but like I said, it's not a silver bullet.
I just have to, because it's either me pay out of pocket or don't take it and be sick every day. And I have to get the pharmacist, Sam, to give me anti-nausea medication. And I'm allergic to gravel, so I have to get something else. So which causes me more problems, right? So not being covered is very, very tough.
Even people who have never been to our pharmacy, they just keep calling and asking about it. So of course, it's a very important topic for them, because like lots of people want to start their health journey, but of course the affordability is an issue for them.
From the Ozempic? Yeah. The nausea. Yeah, I had to get used to that. But I feel fuller longer, which is really good.
It is like partially available. So we received, because of the high demand, so the supply isn't enough. So we are just getting limited supply for now. But I'm quite sure, like as the wheel starts like rolling, like it's going to get better. And also, I hear today that Ozempic, they are offering now a discount, like a discount program or assistance program that will match the price of the generic for people who are paying out of pocket. So this is a great news actually for all the patients who want to start their weight loss or diabetes journey. Yeah, for seniors who have only seniors Blue Cross, they were paying for it out of pocket, because basically even for diabetic people, it's not like for everyone. So basically Alberta Blue Cross covers it under certain circumstances. So it requires special authorization. That means that the prescriber needs to fill a special form and to specify why they want the patients on it. Or it can also go as a step therapy, because it's considered as step 2, and Blue Cross requires the patient to start like 2 step 1s and stay on it for 6 months before approving Ozempic. So it wasn't like, even for for diabetic patients, it wasn't guaranteed that it can be given for anyone. For non-diabetic patients, of course, it wasn't covered at all, and they used to pay for it out of pocket. Oh, it's like it's coming to about 40% of the cost. So the monthly cost now is about 103, 105, around in this neighborhood. The brand name was 280. So it's about 30 to 40% of the cost of the brand name. So it's a huge difference. Oh, 100%. Affordability is like one of the major barriers to access to such kind of medications, because people who have fixed income, I believe lots of them cannot like afford paying 300 or $500 monthly to keep up with the medication. I have seen also people who delay the start of the medications, people who stop it after a couple of months because they couldn't continue on it. I have even like seen people who use it inconsistently, like they instead of taking it every week, they take it every 10 days in order to make the pain like last longer. So of course, like financial burden was a big issue here. Actually, there are many drawbacks. Number one, like the chances of getting side effects would be higher, because like this drug needs to be introduced to the body slowly, and the dose needs to be titrated slowly. So when and like the effect lasts for like 7 days. So when the effect after 7 days, there will be no effect. So when you take the dose after 8, 9, 10 days or 2 weeks, there will be no effect, and you will be introducing the medication as if it's a kind of brand new medication. So some people actually got really bad side effects because of that. So the side effects are mainly related to how the medication works. So basically, the medication mimics the effect of some enzymes that are secreted from the intestine following the ingestion of food. So they work on these receptors of these hormones, and they delay the digestion. So the food will stay longer in the stomach, and this causes the side effects. The main side effects are stomach upset, nausea slash vomiting, constipation slash diarrhea, feeling stuffed up, like I said, constipation or diarrhea or stomach pain. So all of these side effects are expected side effects. So when we introduce the drug slowly and keep increasing it slowly, the body gets like used to the medication. But when we stop it for a while, for a couple of days, and then reintroduce it again, then the body will kind of shocked, because the body forgot about the medication. So, of course, this is one of the points. Also, the efficacy won't be the same, because, like, you are giving your body, or you are delaying the digestion for a couple of days, and then you're stopping it for a couple of days. So the body will start rebounding again and regaining weight again, and then you will take the medication again. So it's on and off, on and off. So of course the effect won't be consistent.
Are there some seniors that should not be on this drug or should have concerns about it?
Of course, 100%. Like, medical assessment is very important. It's not for everyone. It's not one size that fits all. So some patients who are like frail elderly, for instance, cannot take it. People who have like serious stomach issues, or like or they have kind of sensitive stomach, or have gastrointestinal conditions, they cannot take it. Some people who have family history of some cancers, such as medullary thyroid cancer, also they cannot take it. So it depends. This is why it's very important for people to get assessed at the start, and while titrating the dose, and while they are on it, because sometimes like we see like patients who got side effects or started getting issues while being on the medications after a while. So this is why the medical supervision is very important here.
Right. Throughout the whole process, not just at the beginning.
Exactly. And also, it's not about just it's not a complete solution, or it's not a quick fix, it's not a silver bullet. So basically, now obesity is classified as a chronic disease. It's not a risk factor. It's not about eating more. It's related mainly to a complex process that's going on in the body. It includes hormones, it includes genetics, it includes lifestyle. So this is why all of these moving parts need to be considered while putting the patient on this medication while putting a care plan for obesity.
Are there specific benefits that there would be for older adults in taking Ozempic or the generic?
100%. Yeah, of course, there are multiple benefits. One of them, of course, is reducing weight, which has multiple benefits. So, for instance, reducing or losing 5 to 10% of the weight can cause significant health benefits. Also, this family of medications, and specifically semaglutide, it's proven to have a cardiovascular protective effect. That means it protects the heart and the cardiovascular system from the events such as heart attacks or strokes. Also, it reduces the blood sugar for diabetic patients. So, in indirect way, it protects other organs from the damage that can be caused either by diabetes or by the inflammatory state that's caused by obesity. Like also, it helps with the mobility and making the patient independent, especially for seniors. Because basically, when the person loses weight, the burden on the joints would be less, so their mobility would be better. This is one point. Another point, it reduces the bad effect of diabetes on the eyes, on the vision, on the kidneys. So this improves the quality of life for these people, and also makes them independent and like mobile, which is very important.
And how is it taken?
It's taken as injection. I always tell my patients that it's painless. It's taken usually in the stomach, in the tummy here, and it's taken once a week. And it comes as a pen, which is similar like this, and each pen contains usually 4 to 6 doses, depends on which dose the patient is taking. And like a needle like is put on it, and then it's used for injection. The process is straightforward, simple, it's not complicated. With the like appropriate training, it would be easy for patients, or for most of patients.
Yes, there are something we need to be aware of with the how it affects other medications, the multitude of medications seniors may be on.
Of course, like these medications, because I mentioned that it delays the digestion, so it may affect the absorption of other drugs slash foods slash vitamins. So this is why patients need to consult with the pharmacist and see whether there is a drug interaction, especially people who are diabetic, because they will be like on medical like multiple medications. Also, the technique of injection is very important. This is why they need to get training from the pharmacist on how to inject it, how to monitor for any side effects, what to watch for. All of these issues need to be discussed with their doctors and with their pharmacist as well.
And I know you said this isn't a magic bullet. Is there a danger in people looking at it that way and then not being as concerned about, exercise as well?
100%. It needs to be used with caution, and it needs to be incorporated into a whole care plan that includes like a healthy diet and physical exercise as well. And because like we cannot rely only on the medication to achieve health, it's part of the whole plan, but it's not the whole thing.
And what are the concerns with people going off of it? Can you go off of it once you've been on? Will you just regain your appetite again?
Well, actually, it's a very important question. There was a study that found that 50% of people who stop these medications regain the whole weight within 1 year. So it's not a complete solution. It's not, like I said, it's not the whole, like the only solution that we need to rely on. This is why we need to rely on other solutions as well. Because like when this process, which is include like introducing this medication into our body, when this process stops, the body will get back to normal. Plus, After losing the fat, the body will think that it's threatened and it's starved. So it will work hard to regain the whole weight. And also, people usually who are obese or overweight have insulin resistance. So the insulin resistance will come more aggressively, so come back more aggressive. So this is why patients need to use it under medical supervision, and they need to have a plan for what's going to happen after, because if they stop it without a plan, they will regain the whole weight. After how long, we don't know. This is why it's important to keep following up with their healthcare professional.
And is there enough evidence yet to know if it's safe for someone to be on it for, say, a lifetime?
Um, as of now, because there are millions of people who have been using it, the safety profile for this medication is good. However, it's relatively new medication. So we don't know what's going to happen if a person used it for 30 years, for instance, or 20 years. So this is unknown. But what we know is the immediate benefits, which is reduction of weight, reduction of cardiovascular events, and the improvement of diabetes. And these benefits are really major benefits, and we cannot ignore. So until approving otherwise, I believe this drug is now can be used for long term.
Okay. And should people be concerned about the quality of the generic compared to the original?
I believe in Canada we have strict regulations and standards related to the quality of the medications.
Mhm.
However, people are different. The chemistry is different. This is why we may expect some differences. People react differently to different medications, especially when switching from generic to brand, or from brand to generic. So this is why it's a case by case. We cannot. It's not like one size fits all. But I believe having a generic with this cost, which is affordable, is very important step towards achieving healthy life for seniors. Well, actually, we offer complete solutions. It includes nutritional counseling, behavioral counseling. We offer also other solutions which are not medicated. So it's like we tailor the care plan according to the patient's life, medical conditions, like medical history, medications they are on, because people are different. We cannot offer only medication for everyone. So this is what we offer. Besides that, we also offer diabetes management. This includes either starting patients on medications, like managing their medications, ordering lab work for them to monitor how they are doing on their medications. So we monitor the cardiometabolic health within the scope of practice.